This is Radio Health Journal. I'm Reed Pence. This week, how better messaging could get more people to wear masks and socially distance.
We've done incredible, and there's huge support in the population across the world for these things. But that said, we've still failed.
Getting everyone to take COVID seriously when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
My genetics showed a very high sort of association with violence, aggression, and low interpersonal empathy. And those two biological markers then set me on a quest.
Exploring what we do and don't understand about psychopaths. Then,
people think of a black hole as a very dense object, but a black hole is actually not an object at all. It's more like a place.
The fascinating science behind black holes. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
From the beginning of the COVID-19 pandemic last March, it's been difficult to get everyone on board with steps to slow down the virus. We all know those steps by now: wearing face masks, social distancing, and staying home, avoiding crowds. We hear a lot about those who haven't gone along, but some experts say maybe we should hear a little more about those who've been doing everything right. And that's most of us.
We've just undergone the biggest behavior change experiment in probably the history of our species, of humankind. And it's been a remarkable change because it's also happened in such a short time.
That's Dr. Jay Van Bavel, Associate Professor of Psychology and Neuroscience at New York University.
Now I walk through the street and, where I live, I see just hundreds of people wearing masks. If I go in a subway, the grocery store, everybody's wearing a mask. And so it's important to step back and realize how many people are changing, how many people have canceled trips, family events, are figuring out how to work from home. And so that's really been a revelation. We've done incredible, and there's huge support in the population across the world for these things. But that said, we've still failed. We have some weak spots.
Those deadly weak spots are the result of emphasizing the wrong thing in the way experts have talked about COVID, the result of mixed messaging and outright falsehoods. When public health experts say coronavirus is a threat and the White House says it's not, who do you believe?
I think that it did a lot of damage because the American public heard messaging coming from a local level, a state level, and a community level. And so Americans just didn't really know who to rely on or who to turn to. And I think that it's unfortunate that right from the start, I believe, as a communications expert, that COVID has had a communications and messaging problem since the very beginning.
That's communications expert Ashley Bernardi, founder of Nardi Media, a communications firm in Washington, D.C. and New York.
It has been a national tragedy. However, people are still traveling. They are still gathering. They are still not wearing masks despite mandates to wear masks. And we're still impacted by the messaging from the very beginning.
Bernardi and Van Bavel say we should be playing up our successes, like the fact that more than 2/3 of people do mask up and do socially distance, instead of shaming those who don't.
Public shaming is a strategy that can backfire, even maybe more than fear appeals. It can make people disengage, they'd be reluctant to share their true opinions if they're going to get publicly shamed. So that's a risky thing to do with messaging. The other problem with shaming as a messaging strategy is that one of the most effective ways to get people to do something is to convince them that everybody else is doing it. But if you're in the media presenting people who aren't doing the thing and they're rare outliers, you might make it seem to the audience at home that people actually don't believe these practices or public health strategies. And so you can actually have a potential for a backfire effect where your messaging might not work or might even convince people of the opposite message you want to communicate.
Experts have also tried fear and how not masking up could be fatal. Fear has worked to get people to quit smoking, but Van Bavel says the threat of COVID is different.
The research suggests that on average, fear appeals work, but one of the problems is They don't work for everybody, although really no messaging works for everybody. Yeah. And then the other issue is that they often work for a short period of time. And so there might be a thing where people get burned out or, disengaged from the messaging after some point in time.
That could be why some people still aren't masking up, even though the threat is more serious than it was a couple of months ago. We've simply got COVID fatigue. Fear messages are tired old news, and we don't want to hear it anymore.
One way that has not worked that in terms of this scare tactic is the lecturing. And I'm sure that anyone listening here has been involved in some sort of lecturing around COVID these last 9 months. Don't go to the mall. You can't go outside. You can't go to school. Put on your darn mask. Don't go to public gatherings. We're hearing all these, you can't do this, you can't do that. And Americans are hearing, you're taking my freedom away. So my message is that people don't want to be spooked or lectured into social distancing, and they don't want to be told stay home. They don't want to be told that they can't see their family during the holidays. And so this lecturing thing that we're all doing, and I think we're all guilty of lecturing. No, Mom, you cannot go to the grocery store. It's too dangerous for you right now. There's a lockdown. It's not going to work. It's not going to hit the people who really need to hear it.
Rather than a lecture, Bernardi says people need to be told stories, and a lot of people have them. Nearly 70% of Americans know someone who's been infected with COVID.
We need to hear more stories of people who have either survived COVID or who have lost loved ones due to COVID. Now, I realize that if someone has lost a loved one, they may not want to speak out so soon about it. They're grieving. But I'm telling you this because people listen to stories. And why is that? Stories always have an outcome and they are relatable. It makes you more human and less robotic. So this is why we like to listen to stories. So I say my message to folks is if you have survived COVID or if you're suffering from the loss of a loved one who died from it, consider telling your story and sharing that story when you're ready. I assure you it's going to help others and they will start listening, and that's because people listen to stories.
But in your story, even if you're angry at anti-maskers for your illness, Bernardi says try not to use negative words. If you want to move opinion, use positive phrases and power words.
These are words that help you energetically move a conversation forward in a constructive way so that you're more likely to be remembered. So examples could be, well, I'm encouraged by the number of people that I see wearing masks in my community. I'm excited about the creative ways people are coming up with ways to celebrate the holidays in a virtual setting. And I'm motivated to sit tight for a few more months knowing a vaccine is coming. Encouraged, excited, motivated. Do you see how that automatically flips your messaging around to more positive, and therefore you're more likely to be remembered if you're trying to get your point across.
And then repeat the message again and again.
Repetition is the key to retention, right? So if you are firm on your messaging in a powerful way using 1, positive language and projecting empathy, and 3, repeating your message, you're more likely to be remembered.
Of course, positive and negative language can be in the ear of the beholder. Freedom, for example, is a big issue when it comes to pandemic countermeasures. But Van Bavel suggests redefining the word.
The notion of wearing a mask and social distancing have been framed as a challenge or a threat to our freedom. But where I live, and remember, I'm in New York, we were one of the world's hot spots briefly, one of the hardest hit parts in the entire world. When I see a mask and think of it, I think that gives me freedom, because now it means even though before I had to be locked up at home for people to be safe, now I can go on the subway, I can come into work, I can go grocery shopping, I can go for dinner outside where the transmission rate is much lower. And so to me, those practices of moving things outside, distancing, wearing masks, have been tools to regain my freedom. They allow me to and the rest of society around me in our community to reopen things safely. And so now my kids are able to go to school because they're able to wear masks. And so I think of it as a vehicle to regain my freedom rather than a threat to my freedom.
Other words can also create a negative connotation among some groups. For example, a survey by pollster Frank Luntz has found that, in general, Republicans react negatively when you say safety measures are based on science. They respond better when you say they're fact-based. People also push back when someone says we need lockdowns, which sound like you want to put people in jail. Bernardi agrees.
Well, I can totally see that. I mean, those words, lockdown, shutdown, again, it goes back to that negative no, and you can't do that. So be empathetic, project empathy. What does that mean? That means that you're able to understand another person's situation. If you are telling your community to lock down, we don't want to hear that voice of God reasoning. I don't want to be told that I'm not locked down. My kids certainly don't want to hear it. But these leaders, and anyone else for that matter who's a decision maker, needs to show and explain how hard this isolation is. We need to know that these officials are right there with us. Right? We need to say, I know how hard it is not to see your friends and family. I am doing this with you. I will be at home with you for these next several weeks. We understand how hard it is because we are doing it too.
And it's especially damaging if those officials are not doing it, if they're making rules for everybody else and not following them themselves. And now that the vaccine is here, Bernardi and Van Bavel are hoping leaders have learned some communications lessons to get people to get the vaccine.
Let's not lecture. Don't say, you have to get this vaccine. Your life depends upon it, right? Stop the lecturing. Instead, tell the stories. I want to see the stories of the folks who are getting the vaccines, the stories of the medical workers who are benefiting from the vaccines, whose lives are being saved because they're taking the vaccines. We need to hear from them. I want to hear from leaders who are getting the vaccine as well. And then again, understand using empathy as a way to connect with the public. As an example, if a public health official or a medical worker is getting the vaccine, say, look, we understand this is a new vaccine. You may have some concerns about this, but we want you to know that it's FDA approved and it is safe, and, using empathy so people can understand more on a compassionate level where these folks are coming from. And then again, the vaccine definitely needs to be embraced with positive messaging.
If you can communicate if the vaccine is actually effective, so say 90% effective versus 50% effective, many more people are willing to take it. The other thing that mattered is if they saw the message coming from an endorsement from the World Health Organization or the Center for Disease Control, that was more effective than if it came from a political leader like Donald Trump or Joe Biden. And so this is one thing we might think about more, is having respected scientific institutions and health officials share information and be the messengers rather than political figures.
Only about 15% of Americans say they'll refuse the vaccine completely. But one thing health experts have to communicate now is that even though a vaccine is rolling out, face masks and social distancing are still extremely important. Yes, there's a light at the end of the tunnel, but we have to hold out a few months longer. It's delayed gratification, like something Van Bavel calls the marshmallow test.
The way I think of it is through the lens of a very famous set of studies in psychology where little kids were presented with a single marshmallow on a table. And the experimenter told them, if you do not eat this delicious-looking marshmallow, I'll be back in a few minutes, and if it's not eaten, I will give you 2 marshmallows. And you can see videos of these kids online if you want to see the marshmallow test. And they're tortured, sitting in a room alone, little kids staring at this delicious marshmallow. And a lot of them eat it, right? They can't resist. But there are some that wait that 10 or 15 minutes. The experimenter comes back, they get a second marshmallow. And so I think of it very much like that for me. If I cancel my Christmas holiday plans, it means that I'm not going to get infected. My kids aren't. I'm not going to spread it to people. My parents won't be put at risk. And then I think I will plan a trip with everybody there, and we can call it Christmas or whatever we want, but we will plan a big vacation the moment that we get vaccinated. And so if I can just wait a few months, it means I can do all those things I want to do, and I can save my money and wait for that moment, and then we'll all do it safely.
Eventually, we'll get to around 75% of people vaccinated, the point where experts say herd immunity kicks in, and we can start to get back to normal. But that's not likely to be before summer. So as we start the new year, we can expect that the next 6 months are likely to be very similar to the last 9. We can't let up yet. I'm Reed Pence.
A good night's sleep means everything no matter where you are. Luckily, there's a CPAP machine for home and away. The Philips DreamStation Go offers the best of both worlds, a lightweight and discreet travel CPAP designed for everyday use that can be carried wherever you go. Dr. Mark Aloya is Global Lead for Behavior Change at Philips Healthcare.
Most people don't realize that missing just one night of CPAP therapy, which happens often when we travel for business or for pleasure, can put you right back to square one. Now there are more options than ever for CPAP therapy with the recent introduction of travel-sized CPAP devices like the Philips DreamStation Go.
Whether you're at home sleeping soundly or chasing a new adventure on the road, the Philips DreamStation Go is the everyday travel CPAP you want by your bedside. Find out more at philips.com/DreamStationGo. That's PHILIPS.com/DreamStationGo.
This report is brought to you by Bristol Myers Squibb. Despite being the second most common blood cancer, responsible for nearly 13,000 American deaths annually, multiple myeloma is considered a rare disease. Multiple myeloma develops in the bone marrow where normal blood cells grow and plasma cells are made to help fight infection. It crowds these cells and produces an abnormal antibody known as M protein, which can cause tumors, impair the immune system, and more. Multiple myeloma is a relapsing, remitting cancer, meaning the disease is likely to return even if a patient had initially responded to therapy. Each patient's treatment journey is unique. With early diagnosis and various classes of treatments available today, multiple myeloma can be manageable for many patients. Victoria Akins has been living with the disease since 2014.
I tried to be tough when my multiple myeloma started to take a physical toll, but it was hard to accept my new limitations after being so independent and active all my life. I am, though, grateful I received an early diagnosis and that my care team really helped me manage my symptoms. I know that while multiple myeloma is a chronic disease, there are treatment options every step of the way, and I have a great team to guide me. I am glad my life is getting back to a routine that I'm more familiar with.
Multiple myeloma can impair immune function, so it's important to note the potential risk of COVID-19 and stay safe. To learn more, visit myelomacentral.com.
You decided to upgrade your outdoor deck, so you ordered the essentials: a power washer, a set of patio chairs, and a shiny new grill. And you use your Bank of America Cash Rewards credit card, choosing to earn 3% cash back on online shopping and up to 5.25% as a preferred rewards member, which you put towards your most essential deck addition, a bird feeder. Apply for yours at bankofamerica.com/more rewarding. Copyright 2020 Bank of America Corporation.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It's a very sensitive sensing technology that makes the road into a touchpad, much like you would have on your laptop.
Smart roads, amazing technology that will speed your morning commute and make it much safer.
Then getting neglected communities to believe in the COVID-19 vaccine.
The trust that has to be built among the Black community has to be built not just through a few people, but through a governmental system.
All that and more on Radio Health Journal.